Welcome to the Bariatric Nutrition Coach podcast, where we empower you with weight loss surgery, nutrition knowledge, mindset advice, and inspiration so you succeed in your weight and health journey. I'm your host, Jane Stoltz, and I am a bariatric dietitian who has helped over 1,300 people on their weight loss surgery journeys. I'm also a solo mum, lover of long walks while listening to podcasts, partial to a glass of wine, and the ocean is my happy place. Join me as I dive deep into bariatric nutrition and lifestyle topics and deliver them to you in bite-sized, palatable episodes every Monday. Now let's go. Hello and welcome to this week's episode of the Bariatric Nutrition Coach podcast. And I've been thinking about doing this topic for some time, and I've been putting it off because I'm like, it's just not maybe what people want to hear about. It's not, as I've called this topic, the non-sexy stuff, bariatric vitamins, but they're very important. So I want to talk about them today and give some tips to help take them regularly and maybe hopefully inspire you to see the importance of them and how taking your vitamins regularly is actually an act of self-care, and it's actually really, really important after having bariatric surgery. So welcome to this week's episode of the podcast, and I wasn't going to do a video podcast, for want of a better way of explaining it this week. I can do podcasts that are just audio, but I'm doing this one on video, and then the recording goes into YouTube so people can watch it, but also the audio goes into the podcast app so you can just listen to it. And if you're watching this, you might see my right eye squinting a lot. And I wasn't going to be getting on today because I've been rubbing my eye, and I wear sunscreen every day. Being in Australia, I just get into the habit of wearing 30 plus sunscreen every day on my face, and I've rubbed my eye and it's got in my eye. So I'm not winking at you if you're watching the video, or maybe I am, but I'm just trying to kind of manage the stinging. So I did decide to get on, obviously, and let's get into the episode, get into the podcast. But before we get into the really non-sexy stuff, but the really important stuff, I wanted to share a client story. And I really pick out my client stories very carefully, or more kind of specific in the sense of sharing client stories that I know many, many people are going to relate to. And when I do share client stories, I do get a lot of wonderful feedback, and I get feedback that people do really resonate. So this client is coming up to the end of their first boot camp with me. My boot camp is a 4-month commitment, but many people will stay working with me and do another boot camp, in the sense that it's not a program that you have to leave at the end. You can say, well, look, I want to keep working together, but we're coming up to the end of the first month for this client and we're looking at continuing to work together. But I wanted to share her story because so many people relate. So my client started working with me earlier in the year, and at that point she was 14 months post Roux-en-Y gastric bypass. So just over a year. And when she came to work with me, before even we decided to work together, we get to know each other, and we got really clear about some of the things she's really struggling with. People often will say, what's happening in the sense of weight regain, and weight loss had stopped for her. Weight regain had started, and she was really concerned about that. And she wasn't at her goal. She had like 20 more, she has 20 more pounds she wants to lose, or that was what she reported at the beginning of working with me. And when we really dig into things, I got to understand what she was struggling with and what was kind of the habits that she was struggling with that led to her weight loss had stopped and that weight regain had started. So she had returned to, I call the Clean the Plate Club, and many people will relate to this term, and it's you finish what's on your plate. And for many people, this has started in childhood, and it's a really big habit to leave and to drop and to move away from. But that's where she was raising at work, and she actually works in a canteen or a kitchen at the school. So you can imagine food is around. Sugar cravings had come back, and there was little meal planning and prep. So we have the outcomes of weight loss has stopped, hadn't reached goal, weight regain had started. But the things that were really driving that, we've become really clear about right in the beginning of discussions and right at the beginning of the program. And when I start working with clients, in that first couple of weeks in a boot camp, we are observing, we're both observing, and then we come up with goals and we both contribute to my clients' goals to get really clear about what are the key things we're working on over our period of time of working together. So we became clear, we put some goals in place, and they related to not listening to hunger and fullness cues, grazing, sugar cravings, meal prep. So the goal sat around those areas for my client. And so what we worked on, well, I always will take, unless someone's in those really early weeks of after weight loss surgery, we went back to basics. We went back to, I call them weight loss surgery foundation eating habits. For this client, listening to hunger and fullness cues were really key. And we did some great work, and she's doing great work with hunger and fullness cues and using the hunger and fullness scale to really get to know her body again post-surgery and really listen to her body letting her know when she's hungry and also when she's satisfied and eaten enough. And that feeds into that clean the plate club of listening and being comfortable, put down the cutlery and stop eating when you're satisfied. And all the things that came out of that, and that come out of that for many people of food wastage and emotional hunger, and then finding those hunger and fullness cues. So she's done some great work there and does a great job of tracking those hunger and fullness when she's tracking her intake, and so really wonderful. We went back to the basics of protein and really building more protein into her diet and more consistent. Okay. And also eating schedule. An eating schedule was super important to get that regular eating in to help manage that grazing. And we are getting ready because we're talking about continuing to work together. We're looking at an eating schedule and really adjusting that as my client gets ready to have a really good break over spring break, because working in a school environment, she works in line with the school year. So she's going to have a really good break. And that's really common that people can establish an eating schedule when they are working, and then it kind of falls to the wayside on the weekends, on holidays, and teachers and people that do work in schools then really can struggle, like this client, on those extended breaks. But we want to keep up all the great work that she's doing and keep eating regularly and keep doing great work even when she's on holiday. So that's some of the work that we've done together. And this week we had a lovely catch up, a lovely kind of check in, and we looked at the goals. We looked at the things that she was struggling with in the beginning that we pulled into the goals. She reported a 75% decrease in grazing at work, which is wonderful. 50% decrease in cravings, which is fantastic. And I asked her what she felt were the main contributors or the things that have really helped decrease craving. She said more consistent protein intake, which is wonderful. And when it comes to weight, where she has progressed from a weight perspective is actually a great progress. And I had to let her know that what was happening with her weight and her progress was actually really normal, and I saw as great progress. Her weight had stayed about the same, but her measurements had decreased and she had dropped a size in clothing. And some people, this can take a little bit of time to get your head around, because you think the scales are the be all and end all. And what happens over time is, after bariatric surgery, is your body composition changes. And so you get more active, your body shape changes, especially that 1 to 2.5 years after surgery. Muscle, lean body mass can increase, scales can stay about the same, but you're getting smaller. And also people can say, as I said to her, you're looking like you've lost weight. And so this comes into what I talk about a lot of really looking at your relationship with the scales. It doesn't mean that she won't continue to lose weight further down the track, because we've only been working together 4 months. But I was really thrilled with this progress. And I talked to her about really being very positive about it as well, because the body is giving you feedback, but in the clothing size, in measurements, the scales are only one way of measuring and they're not that accurate, okay? Muscle weighs more than adipose tissue, which is fat tissue. So I was really thrilled with her progress. She'd done really wonderful work. And the work I do with my clients is not short term, getting a few kilos or pounds off and then off you go. We are laying down foundations, habits, really embedding behaviors for the long term. And that's why I see many people getting lost in the long term in those early days, had really good education and support, because get lost when you don't know where to go. And even if you go off track later on down the track, that's normal and fine to some degree. You're going to go off track, but I want my clients to know how to get back on track and where back on track is. What are the key things I need to keep practicing, go back to practicing. So getting lost and being really worried about weight regain and not confident comes from not really knowing where to get back into your zone, back on track, or whatever those words are for you. So I wanted to share the client story while working with her this week, and kind of that coming together at the end of the first 4 months of working together, because I think it paints a really common struggles, a really common work that I do with clients, and really great outcomes. So that's my client story. Let's now launch into the podcast, the episode, the non-sexy stuff, bariatric vitamins. Don't turn off, don't leave. I'm going to make this as fun and interesting as possible. And if you listen to my podcast, and I'm slowly getting more relaxed on podcasts, and you'll see I've got a bit of a quirky sense of humour. If you think I'm joking about something, I am, but I can be a little bit dry. But I call it the non-sexy stuff. And what do I call the sexy stuff in bariatric surgery? Generally, what I call the sexy stuff is people want to know the meal plan, the recipes, and that comes from that years of dieting. Give me that and it'll all be great. All my problems will go away and I'll lose all the weight I want to and it'll be done. I won't ever graze or snack again. But it doesn't work like that. And one of the big challenges for many people after having weight loss surgery is taking your vitamins every day. One, I feel it's that compliance, and I'm going to talk more about that, of taking them. But two is also really, it's never been explained well enough or in depth enough or sold to you the importance of taking your vitamins. If you hear anything, yes, the lawnmower man has started to mow the lawn outside my mum's house. I'm living with my mum still. If anyone follows me on Instagram, I don't talk about it a lot, but I'm building a house, and I'm hoping in 6 weeks, around 6 weeks' time, I'm going to be coming to you from my new house. It's been a long time. But anyway, lawnmower man. So let's talk first why. Let's go into the why we ask you to take vitamins, and then we're going to talk about all the things that can get in the way of taking vitamins. I think we really need to start with the why, because that helps the motivation and really the understanding of why we ask you to take them. Now, in this episode, I'm not going to tell you what to take, but I'm going to tell you kind of really the big picture of why. And in a nutshell, when you have bariatric surgery, your anatomy changes. Different procedures, whether it's a sleeve gastrectomy or whether you have different bypasses, your anatomy will change to different degrees. So it changes less in a sleeve to some of the more significant bypasses. And they're doing a range of bypasses now all over the world. Mini bypasses, one anastomosis, SIPs, SARDS. And essentially, the more extreme, for want of a better word, bypass, the more of your GI tract, your gastrointestinal tract is bypassed, and that's your small bowel that they're bypassing. The small bowel has 3 different parts. You've got your duodenum, your first part, you've got your jejunum, and you've got your ileum. It's around 6 meters long, the small bowel. And the different bypasses will bypass different lengths of that small bowel. And what that means when you do have a bypass is that you are having some non-absorption. You're not giving your food that you've ingested the same amount of time to be broken down and digested and absorbed, and the nutrients taken out of that food. Do we change your anatomy with a sleeve? Yes. So with the bypasses, yes, you'll have some change to the tummy as well, whether it's a sleeve or with say, a SIPS, a SARDS, or whether you come out with a pouch. So anatomy changes from a stomach perspective, And then if you've got a bypass, it's the bypass of the small bowel to varying lengths. So there's no one set of vitamins for all bariatric procedures. It is different depending on your procedure. But the key thing I want you to remember is when your anatomy changes, how you absorb and utilize your nutrients changes. So at the same time, you can take in less food. So those two factors mean to keep certain vitamins and minerals levels up. Over the years, the evidence has shown we need to ask you to take specific vitamins and minerals after bariatric surgery. And good vitamins and minerals, the companies that have the good products, and there's lots of them around the world, they make their multivitamins and other supplements in line with the guidelines and in line with good key guidelines. Different countries have different guidelines. In Australia, we follow the American guidelines, the American Society of Metabolic and Bariatric Surgery, ASMBS, and different organisations feed in and support the building of those guidelines. They don't come out very often, they don't get updated very often because they are very big pieces of literature which look at all the research and say, okay, after bariatric surgery, you need to take in extra vitamin D, extra calcium, iron, some more folate than a person that hasn't had bariatric surgery, more B12 and those types of vitamins and minerals, zinc and other things. So the good companies that make the bariatric vitamins look at those guidelines and get you a bariatric specific multivitamin. And there's other things that we want you to take, such as calcium. And we ask you to take, and I know I'm repeating myself, those types of vitamins because they're giving you extra of key vitamins that you need to take to kind of balance things out because your anatomy's changed and how you absorb and utilize your nutrients has changed. Plus, you're eating less. Okay. The goal is, and my goal when I'm working with clients is to take the least number of vitamins to support you to keep your pathology, your blood levels at a good level. Now, when people have more significant bypasses, such as the duodenal switches, the SARDI, SIPS type procedures, depending on what you've had, we need to add some even extra things in than maybe you're not having when you're having a sleeve. And the fat-soluble vitamins, the A, D, E, and K, are the types of vitamins that are adding in extra for some of those procedures. But your clinicians, your bariatric surgery centre, your bariatric dietitian will and should guide you on the right vitamins for you. And the reason why we ask you to take them regularly is because it can take several years for deficiencies to arise. So many times I've spoken with people, I've started working with people, and they say, I hadn't taken my vitamins for 6 months. I had my bloods done, my pathology done, and my bloods are fine, everything's fine. So I don't need to take them. And then I go into all this explanation of that's great that everything was fine at that point. But when we are looking at your pathology levels and your blood levels, we're not just looking at what they are right then at that moment. A good clinician is going to look and say, what were they last year or last time you had them done? And then track what happens over time because we want to look at, for example, iron, really big one. We watch like a hawk after bariatric surgery, especially in women. What is your iron doing? What are your iron stores doing? Are they staying flatlining, so to speak, and stable? Are they going up slightly or are they going down? So it's not just where you are right now. So you might have good levels. A year later, you start feeling crummy. You think, I'm tired. I'm not feeling like I'm good. And a lot of women will leave it till they're feeling really, really crummy, go and get their bloods done. We're into some deficiencies. We need to top up. And there are some really key things that we watch like a hawk as well after bariatric surgery because there are some really significant outcomes if you do get deficient in things like folate and B12. So a range of things. I'm not going into big specifics. I want to we don't ask you to take bariatric vitamins every day for no reason. I would love, and I talk to my clients about seeing it as self-care. Do you have to take them 100% of the time? No. If you take them most of the time, usually that's enough. And when I'm working with clients, I want to get the simplest regime to keep everything at a good level. And then if your pathology results say, we're low on this, we're low on that, we add extra in of those specific ones. The reason why I want to keep it as simple as possible is because it supports compliance. It helps the hip pocket. It doesn't cost you as much money because supplements are expensive, but they're worth the money and we take the least we need and we only add in things when we really need them. So that's my why. What your friend is taking does not necessarily mean they've had bariatric surgery, doesn't mean that is the right regime for you. It is about getting your personal regime and then getting it tailored over time. So with your diet, you take that regularly, all your levels are staying roughly the same. But also with that said, after 2 years after having bariatric surgery, it is recommended every year you have blood tests done. Even if I say you feel like $1 million, the sun's shining, you feel amazing, still once a year, it's like you put your car in for a service, you go in, you get your bloods done, you get checked just to see where you are, okay?
Now tell me, is this you? You have had your bariatric surgery and you're feeling lost, you're lacking support and you don't know what to eat and when. Or you may have noticed after your surgery, your hunger and cravings have started to return and you are scared you won't reach your goals. You may have had some weight regain and you want to stop the weight regain and lose some more weight. You may be pre-surgery and you want support to be fully prepared for your weight loss surgery journey. If any of these sound like you, then listen up. I have developed my Bariatric Nutrition Bootcamp just for you. My coaching program provides education, coaching and community for people getting ready for their weight loss surgery and at every stage after their surgery. There are 4 key areas that I focus on with my clients in my Bariatric Nutrition Bootcamp. One is the bariatric nutrition basics. You will learn what and how to eat so you feel satisfied, reach your protein and fluid goals and have less cravings, and know how to manage your hunger in the future. Meal ideas and meal planning. You will learn to plan meals and snacks that you like, so you have great options on hand when it comes time to eat. Also, we focus on mastering weight regain habits, identifying any habits that are stopping you from reaching your goals and create manageable strategies to get back on the straight and narrow so you can manage your weight for the rest of your life. And also, I focus with my clients in my Bariatric Nutrition Bootcamp on learning to trust your body and food. Start to enjoy your food again by relearning to listen to your body cues so you have less guilt and improve your relationship with food and your body. If you are ready to maximize your weight loss surgery results, feel confident in your journey and be led with support and expert guidance, then the Bariatric Nutrition Bootcamp is for you. If you would like to know more about my coaching program, check out the link in the show notes.
So that is just good self-care. So that's my why, okay? And now I want to talk about compliance. Many people, even if they've taken other medications before surgery, taking vitamins and medications is really hard to remember to do it every day. And that's why I say we don't want to beat ourselves up if we don't do it every day, if we occasionally miss a day. It's what you do most of the time, okay? So compliance is a term used medically about people remembering to take their medications. And for most primary care providers, it's one of their biggest challenges. It's not just writing out a script for their patients, it's actually getting them to take the medication. And with medications, it can feel a bit more important than taking vitamins. But I like people to see their vitamins as a medication, as a really essential part of living well and taking care of their health post-surgery. So it's about, and I'm going to go into tips in a minute about how to take them regularly. But you might want to reflect on, and I'll just do a little bit of this before we go into those tips. as I do my podcast, I really love people you can stop them. And if you're getting in and out of the car, it might give you time to reflect on this, but you can reflect on how well you've taken your vitamins since your surgery. What gets in the way of you taking your vitamins? What do you think about your vitamins? Do you have I was about to say a love-hate relationship, or maybe it's just a hate-hate, meaning don't see the point, don't make you feel good when you have them, you haven't ever really bonded with them, so to speak. And I want to talk about when I get to my tips, I think that's going to help you. But it's really good to reflect on, what do I think about my medications, if you take medications and vitamins, and do I see them as difference between them, and what are my thoughts about them? Because that's really good to be aware of, because that's going to get in your way of taking them. Now, I want to go through 3 tips that can help you take your vitamins regularly. And the first tip is to talk about a strategy of actually how to take vitamins if your vitamins make you feel nauseous. Now, there is a lot in a bariatric multi. They pack a punch. There's a lot in there. And if you or many people take them on an empty tummy, they can make many people feel nauseous, make many people feel really crummy. And if I take a multivitamin on an empty tummy, I'm reaching over the toilet and my mouth waters and all of that. So a strategy you could use if taking your vitamins makes you feel nauseous is, and I'm going to go into it, but first I just want to say, if that has stopped you from taking your vitamins, I don't want you to beat yourself up, because if we take something that makes us feel crummy, human nature is, oh, I don't want to take that again because I feel so bad. But this strategy is very effective. And I would encourage you to open your cupboard where those vitamins are and try this and see how it goes. And this is to take your vitamins, your multivitamin, with food. And yes, you could say, Jane, I need to take water, something to get my vitamin down. And you can. Yes, we don't want you drinking a lot with your meal, but what I encourage you to try is a few bites of food, then a little swig of water with the vitamin to get it down, and then you continue your meal. Because when we have food in the tummy and then we put a vitamin in there, we have more food, the food kind of buffers the vitamin and lines the tummy a bit and helps make it, just better tolerated. So that's a really good strategy for taking it. And you might have 4 or 5 bites of food before you take your vitamin. I've had many people over the years say they take it just before going to bed. Doesn't seem to worry them. Whereas if they take another time of the day, they get nausea. So really it's around trying and see what works for you. There is, and I'll mention it now because I was going to mention it soon, but a key thing to remember, and many people do get told this, is that bariatric vitamins, we want to separate them from your calcium. And the reason why is that calcium will impact or interfere with iron absorption, and a good bariatric multi, unless iron plays up with your tummy and you're getting a multi with no iron in it, a good bariatric multi will have iron, 45, 60 milligrams of iron in it. We want to have our calcium separate. So that's just a key thing. Can't take them all together. Need 2 or 3 hours between taking a multi and a calcium. So that's tip number 1, is to take your multi with food if it's been nausea that's getting in the way of stopping you taking your multi. The second tip is to really, and you're going to go, oh, not that again, but establish a regular eating schedule, because when we get a regular eating schedule and we get routine in our day, that really helps build habits. Routine helps you build habits. Routine helps people take their vitamins. There might be the vitamins sitting next to the kettle in the kitchen, and that is there to remind them to take their vitamin with their breakfast in the morning. Got a client that puts their vitamins on their windowsill, and when she's washing dishes, she sees them. That's her cue to take them. So routine can really help. You can just get really used to having your vitamins, say, with your breakfast in the morning or having it with dinner in the evening. Some people also might put them on their desk and have it with their lunch, because they have their lunch at work and they have their multivitamins at work. Whatever suits you. And sometimes playing around with your routine and getting a really regular schedule can help you remember to take them. It's not, you don't have to take them at any particular time. It's what's going to help you remember to take them. And tip number 3 is putting reminders in your environment. Visual reminders. So yes, your vitamins here and there. Post-it notes can be really helpful, meaning you can have a post-it note out. You put that out every morning in that building that routine, take your vitamins. You might even put your vitamins on your post-it note the night before. Putting reminders in your phone, the reminders on your phone can be wonderful. And that can be a little bell that rings at a certain time in the morning when you're getting your coffee roughly, and it reminds you to grab your vitamins out of the cupboard and put that there and take them. So reminders in our environment are really a wonderful thing to do. So I'm just going to recap on these tips. 1, you can take, if nausea is getting in the way of taking your vitamins or has got in the way in the past of taking your vitamins, can it be different vitamins help you cause less nausea? Yes, but a really good strategy to try is maybe 3, 4, 5 bites of food, then a little swig of water to get your vitamin down, and then any more bites of food that you can take. 2 is getting a regular eating schedule, getting a routine into your day. It's like that routine of brushing your teeth before you go to bed, and it becomes a reflex, but it's practice, it's practice, it's practice. And number 3 is reminders and things in your environment that help you remember to take your vitamins. It might be a post-it note in the car. It might be having calcium in your handbag and you take it to work and it's on hand, and then you've got a reminder in your Google Calendar or your Outlook calendar. Do people use Outlook anymore? I think they do. That's just a bit of me being teasing because I'm all into a big fan of Google. So reminders are really, really important. So that is my podcast episode for this week. And we've meandered through a client story and then into the vitamins. I know it's not most people's favourite topic. I know people cannot roll their eyes but feel like it's a bit of a thorn in the side of, oh, why do I have to do this? What's important? I want you to see it as, and I hope you can, look at it from a different angle. See, taking your vitamins as an act of feeding yourself and an act of self-care. And just know that it can take several years for some deficiencies to show up. And we don't want you to get to that point because you feel crummy, feel tired for a long time before you even get to the doctor. And most people and most women aren't, I feel a little bit tired. I'm going to check this out at the doctor. I don't want you to suffer like that and feel like that. And also some deficiencies are really serious and there's some really serious implications to them. And this is not to scare you. We don't ask you to take vitamins for fun. It's just that it's a really important thing to do. So thank you. If you've got to this point in the podcast, good on you. You've got through a non-sexy topic. I hope I've made it sound a bit interesting and maybe worth another look. If you have got some vitamins collecting dust in your cupboard, pull them out. If they're just a bit overexcited, still use them. Get into that routine of building this into your life and really looking, maybe put a sticker on them, self-care. Well, my name's Jane, self-care for Jane, my self-care. It's good for me. Some kind of phrase on those vitamins that inspires you to take them. So they don't look as exciting as makeup, but maybe you put something on them, around them that makes them look a bit more glamorous than the non-glamorous stickers that they have on them. So I hope you've got some value out of this podcast. I really appreciate your support. I appreciate you listening. Gold star for you for getting to this point on this podcast. Been putting it off for some time, and I really appreciate every bit of comment and every bit of support that I've been getting for my podcast. It really makes a difference. Thank you so much for listening, and I really look forward to being back in your ears or maybe even your eyes next week. Bye for now.